Bevacizumab, or trade name Avastin, is an IV anti-cancer drug that is an antibody directed against a VEGF receptor. VEGF, it's like VEGF, is a specific protein that's useful in the formation of blood vessels. The way that bevacizumab works is, as an antibody, it helps the body's own immune system decrease the tumor's ability to make new blood vessels. As a tumor is growing, it needs new blood vessels to supply nutrients to the growing tumor. So if the new blood vessels aren't able to form, the tumor either doesn't grow or sometimes shrinks and dies. Because it's an antibody, it doesn't have the same side effects that we think of when we think of traditional chemotherapy. You can have an infusion reaction with bevacizumab, but that's unusual actually. You don't get nausea or vomiting or hair loss, diarrhea with bevacizumab. Side effects that we see with bevacizumab include changes in your blood pressure, usually elevated blood pressure, and also sometimes you can have swelling in your limbs, especially your ankles, from losing too much protein in your urine. Rare but serious problems from bevacizumab can include blood clots, which can be either a vein clot or an artery clot, which would be a stroke or a heart attack. There's also an increased risk, although it still is very unusual, to have a bowel perforation. And what that is actually a microscopic hole in your colon or intestines that can be very painful and can be life-threatening. Another rare problem from bevacizumab is what's called posterior reversible encephalopathy syndrome. Basically what that means is that there can be some problems in the blood vessels that are in the balance part of the brain called the cerebellum. And patients that have that can have problems with dizziness or imbalance, and it often gets better by stopping the bevacizumab.